Pregnancy is such a beautiful thing, but nutrition during pregnancy is also another key thing. So today I've decided to do a video, and our today's topic is very important during pregnancy. Actually, I think this is my first video I am doing concerning pregnancy. So today I will discuss about minor disorders that are nutrition related during pregnancy. Minor disorders that are nutrition related during pregnancy. And I know every pregnant woman has experienced such. If you're watching me for the first time, my name is Ken. I am a certified nutritionist, and I also do content about nutrition and lifestyle. So kindly, if you are here on the channel for the first time, consider hitting that subscribe button. Watch my videos until the end. Share my videos. Also comment. If you are my returning subscriber, thanks a lot for the support, and I don't take it for granted. So without wasting much time, let's start our video. So today I have said we will discuss about the minor disorders that are nutrition related during pregnancy. Now, the first thing I'll talk about is actually indoor part 1. Nitafanya part 2 about the same. So this is part 1. And the first thing I'll discuss is about morning sickness. Hakuna any pregnant woman haja experience morning sickness during the pregnancy period. So about morning sickness, nataka tuelewe what is this? Hii morning sickness ni nini? And morning sickness ni ugonjwa yenye it is characterized by nausea and vomiting. So nausea ni ile feeling yenye unasikia kutapika but haujatapika. So it is a sickness that is characterized by nausea and vomiting. And actually it happen mostly during the first trimester. And the first trimester is the first 3 months of pregnancy. So about hii ugonjwa inaitwa morning sickness, one of the things yenye itakusaidia during this time is eating small frequent meals. And by the way, vile huwa tunasema, of course mtu anaweza kuambia eat small frequent meals, but sasa you don't know the duration of those feeds from like one feed to another feed. So it's on intervals of 2 hours. So for example, kama umekula breakfast at around 8 in the morning, it means maybe around after 2 hours, of course, is saa 4. So hapo saa 4 it means you'll have to eat a healthy snack, and then maybe lunchtime you'll eat a well-balanced diet. So healthy snacks, of course, is not sausage, is not samosa. It could be maybe a cup of uji. It could be maybe fruits. It could be maybe eggs, or maybe at a cup of soup. Vitu kama hizo, sio hizo chocolates mnakula and stuff. So first thing tumesema, eat small frequent meals. That one will help you. The next one yenye itakusaidia ni itabidi you have to avoid smells and maybe foods that will make your sickness worse. So of course you have to be keen. Kuna chakula yenye ukikula during pregnancy, during that trimester, and then ukikula you feel maybe ndio unasikia kuvomit, you'll have to stop that. So you have to be very keen on the foods you are eating during that time. Na kitu ingine itatusaidia ni maybe kukula citric fruits. Citric fruits zenye ziko na hiyo ukali. And an example of a citric fruit ni maybe the lemon. So you can choose to kuweka a lemon, unaweka ndimu kwa uji, or else maybe unaweza kula hivyo. And another one, maybe it's oranges, maybe tangerines, maybe also pineapple. Those are citric fruits. Maybe passion fruits pia. They are very important, zitakusaidia sana if you have that feeling during pregnancy. And the next thing yenye inaweza kusaidia ni actually you have to avoid fatty foods na maybe sugary foods. So that means vitu kama chocolates, vitu kama sweetened yogurt, vitu kama kuweka sukari maybe kwa chai. So of course ukiweka hata even if you are not pregnant, by the way, na ukunywe chai yenye iko na a lot of sugar, you feel that nausea. So you have to avoid less fatty foods, and you have to, eat less fatty foods. So fatty foods of course ni vitu kama chipo, those bajias, mandazi. Kuna zingine tukiwa high school tulikuwa tunakula zinaitwa KDF, sijui kama they exist. Vitu kama hizo you have to avoid during that time. So that one is morning sickness. I think nimeongelelea, and then nime explain what it is and the foods maybe you're supposed to eat and the foods you are not supposed to eat during that time. So the next thing I'll talk about is constipation. Hakuna mtu haja experience constipation, whether you are pregnant or not. Even as guys, we experience constipation. May it be a little kid at experience constipation. So constipation majorly means having a problem passing stool, and it's fairly common at whatever age. It's fairly common, and especially sana watu who experience that constipation sana are the elderly, because most of the people at that age utapata wanakata chakula, wanakata even kukunywa maji. So mostly the elderly experience constipation, and those babies who have begun to wean maybe or eat complementary feeding. Mtoto akifika 6 months akianza feeding, most of them experience constipation before they start adapting the feeds. So constipation is something yenye is actually common during a pregnancy. Na as I've said, it's barely just a lack of dietary fiber, at fluids, and also maybe at exercise can cause constipation during pregnancy. So during pregnancy you experience kitu kama constipation, of course unasikia tumbo imejaa gas. You have to eat a diet rich in fiber. So fiber actually is very important because fiber helps in constipation. It helps in digestion. Fiber helps in regulating your blood sugar levels. So inamaanisha kama ukikula chakula yenye iko very rich in fiber, itakusaidia to prevent ugonjwa kama diabetes. So fiber rich diets, lazima tuangalie hapo hizi ni chakula gani zenye, kuna mtu of course atajiuliza hizo ni chakula gani zinasaidia with that fiber. And number one I would say avocados have fiber. Pia tuko na machungwa. We also have carrots. We also have dania. And about dania, nataka you get this. Dania, it's not about the leaves. It is about the stem. Hiyo stem ndio iko na a lot of fiber. Ndio iko na fiber. So of course kuna wenye wakipika chakula you tend to just pick out the leaves and hizo wanapika. And then you throw away the stem. The stem is very important to iko na fiber. We also have tuko na machungwa, tuko na tangerines, tuko na pixie, tuko na also pawpaws, tuko na vegetables pia, skuma, cabbage and stuff. So fiber is very important. Also we have vitu kama brown rice, we have brown chapati, we have brown bread. Very important. It has a lot of fiber. So fiber is very important during pregnancy. You at least if you're experiencing maybe stomach discomfort, uko na gas, itakusaidia sana. Also another thing very important during that experience of constipation, you have to drink a lot of water. And the recommended water intake is 2 to 2.5 liters in a day. Utasikia mtu anakwambia 80 glasses in a day, but you have to be specific. The moment unasema 80 glasses, you have to say glasses of 250 mils, because 4 glasses of 250 mils, that is a liter. So if it's 8 glasses of 250 mils, hiyo ndio itakuja lita 2. So you have to be very specific with your glasses. What is very important, leave alone kukusaidia na hiyo constipation during pregnancy. Vile unashinda ukikojoa, it will help cleanse your kidneys. Na pia maji inatusaidia in regulating your blood sugars, inakusaidia kuregulate your blood pressure. It helps also in digestion. It helps in something tunaitanga thermoregulation. Thermoregulation is about your body temperatures. Maybe usikue unasikia uko na fever ama low body temperature, so it helps in regulating your blood temperatures. I mean your skin, your body temperature. So what is very important, that's why unasikia what is life. Unaweza ishi for long actually ukikunywa maji without taking food, but huwezi ishi sana ukikula food and you're not taking water. So what is life? So exercise, very important during pregnancy also, na itakusaidia actually if una experience gas kwa tumbo, kutembea is very important. It will help to remove that gas. But kama unakula foods that are not rich in fiber and then you're just not physically active, it will not be easy for you. So exercise during pregnancy, come on, experience that constipation is very important. So the next thing I'll talk about is heartburn. I am sure everyone has experienced heartburn during pregnancy. I am 100% sure. So of course mtu anaweza jiuliza, na hii heartburn, how does someone feel? What is it about? So during pregnancy, heartburn ama yenye tunaita acid reflux is a common discomfort yenye it's characterized by tunaweza sema a burning sensation in the chest, na inakuanga often triggered by ile stomach acid ikiflow back into your esophagus. Na it's actually caused by some hormonal changes during pregnancy. And usisahau pia mtoto anaendelea kugrow. So the moment ana grow, ana press, wana put pressure on your stomach, hence causing the acid reflux. So heartburn is very common, but pia iko na solution, and it's nutritional also. So one of the things you have to avoid during that heartburn is you should avoid chocolates and the fatty foods zenye tumesema, the chips, bajia, mandazi, deep fried foods. Also alcohol is something you're supposed to avoid during heartburn. And it's not only during heartburn. Alcohol is something you have to avoid during pregnancy because it will affect your baby negatively. And about these chocolates and these fatty foods and that alcohol, you have to avoid them, especially during before bed. I mean that. You have to also avoid acidic foods. Come on, experience your heartburn. And the acidic foods ni vitu kama tuko na kales, that is skuma, tuko na the citric fruits, the passion, pineapple, oranges, tangerines, pixie, and also the beans are acidic. Lemon also, kitu yote iko na acid, you have to avoid during come on, experience heartburn in pregnancy. You also, you are not also supposed to lie flat during sleep because that one will unajipress, so that one inaweza saidia the acid to go back to your esophagus and you will experience heartburn. So don't sleep lying flat, unafaa ulale vizuri, maybe on the side. Kitu ingine pia is you have to eat slowly. Kuna watu naturally kazi yao mnaweza nunua food at the same time, maybe you are served food in the cafeteria at the same time, but anamaliza within a very few minutes. So you have to eat slowly, drink fluids, zenye tumesema hiyo maji, and even the other fluids, maybe soups, very important. And you eat small frequent meals. And I said small frequent meals, the interval is after 2 hours. You have to give an interval of 2 hours before you eat. The last thing I'll discuss is called PICA. P-I-C-A. PICA is very common. And maybe someone would wonder, what is this PICA? So I'll explain, don't mind. So PICA is craving for non-foodstuffs. PICA can happen at any time to anyone, and mostly it is experienced by women who are pregnant. So I have said PICA is craving for non-foodstuffs. And this happens when your body runs low in certain minerals and nutrients, especially iron and zinc. So if a woman runs out of these things, iron and zinc, high chances are that you will experience PICA. So it is very important you consider iron-rich foods during pregnancy. It will help you kick away this PICA thing, and it will also help you to boost your blood. Having an adequate blood is very important during pregnancy, because of course you will lose a lot of blood during delivery. May it be normal delivery, may it be you deliver via CS, you will lose blood. So having adequate blood during pregnancy is very important. And about the iron-rich foods, ni vitu kama eggs, liver, red meat, beetroot, spinach, and other green leafy vegetables. I'll discuss about that. I'll do a video about iron-rich foods. About zinc, eggs have zinc, dairy products also have zinc. So you have to consider iron and zinc-rich foods during pregnancy so that you may kick out that PICA thing. So ensuring ensuring that a pregnant woman has met her nutritional requirements in a day will help to kick out that PICA thing. So those are the minor, that is the part one of the minor disorders that are nutrition related during pregnancy. I'll do another video, part two of that, which will be coming soon. So I hope you have enjoyed my content. Please kindly watch my videos until the end. And if you are new to the channel, kindly consider subscribing. Hit that subscribe button. Share my videos. Also, give me ideas on the topics you want me to discuss on my upcoming videos. Just comment and I'll discuss about those topics. Thanks a lot for the support. Continue watching my videos. Thank you.